Welcome to The Explainer. So today, we're digging into Alberta's massive effort to tackle poverty. We're talking billions of dollars. But here's the puzzle that the source material we're looking at really brings up. The more money that seems to be spent, the more we hear about something called a social deficit. It's a bit of a paradox, right? So we're going to break it all down by looking at it like a simple balance sheet.
Yeah, this is really the core question, isn't it? Alberta is pouring billions into social programs. So why is there still this social deficit we keep hearing about? What's not adding up here? That's exactly the disconnect we're going to get into.
Okay, so to really wrap our heads around this, let's think of it kind of like a business balance sheet. It's a really helpful way to see the whole picture. We're going to look at the investments, the money going in. Then we'll look at the deficits, where the gaps are. And finally, what the potential return on all of this could be.
All right, first things first. Let's start with the investment side of our balance sheet. And wow, we're talking about some huge financial commitments that Alberta has on the books for social programs.
And these numbers are seriously big. The analysis we're drawing from really breaks it down into 4 key areas. First up, you've got a massive $1.1 billion set aside for affordable housing over the next 3 years.
Then, check this out. Almost $2 billion is budgeted just for childcare. I mean, that's a huge deal for making it more affordable for families across the province. Next on the list is $1.64 billion for the AISH program. That's the Assured Income for the Severely Handicapped program, which is a lifeline for Albertans who can't work due to a permanent medical condition.
And finally, another $1.25 billion is allocated for employment and income support. So when you add all that up, we are talking about a truly massive financial commitment.
So, okay, with all that money being spent, you'd think the books would be in pretty good shape. But this is where we have to flip over to the other side of the ledger, because the analysis points to this thing it calls a social deficit. Basically, it's where all that investment just isn't quite hitting the mark when it comes to the real need out there.
So what's really driving this deficit? Well, the analysis says it's a core structural problem. The spending, as big as it sounds, just isn't keeping up with how fast the population is growing, plus inflation. Think about it. That means, in real terms, the value of these services is actually shrinking year after year. It's like you're losing ground even while you're spending money.
Now, this is where it gets really interesting when we talk about that funding gap. The analysis brings up a huge what if. It compares Alberta's tax system to British Columbia's and points out that, hey, if Alberta had a system like BC's, it could bring in an extra, get this, $20.1 billion in revenue. That's a massive opportunity cost.
And on top of all that, you've got the bigger picture of the province's finances. We're looking at a projected budget deficit of $5.2 billion. That creates a ton of pressure, and it just makes it that much harder to find more money for social programs, even when you know the need is there.
But it's not just about the total amount of funding. The analysis identifies a second really critical deficit, the adequacy gap. This is all about the gap between what people get from social assistance and what they actually need to, live. The numbers are pretty stark. The current rates only cover about half of what's considered the official poverty line.
And really, this quote from the source material just says it all, doesn't it? It's just not possible to make ends meet. When people are in that situation, it's not just tough, it creates this constant cycle of crisis that's incredibly hard to break out of.
And here's a really specific example of what we're talking about. Look at the AISH budget. Yeah, it's a big number, $1.64 billion, but it's actually set to decrease by $49 million from the previous forecast. So that really makes you wonder, right? Is the funding actually keeping up with the real growing need?
And there's one more gap the analysis points out, and this one's more about strategy. If you look inside the budget for addictions and mental health, you'll see there's no new money specifically for harm reduction services. That's a pretty notable absence, especially when you think about it as one of the key pieces of the puzzle for a complete system of care.
Okay, so we've looked at the investments, the money going in, and we've looked at the deficits, the gaps, but the story doesn't end there. Now we get to the really powerful part of our balance sheet. What's the potential return on investment if we actually close those gaps?
But before we talk about returns, we have to get our heads around this idea of the cost of inaction. This is so important. It's not about the money we're spending today. It's about the huge, long-term price tag. We're talking real dollars and social costs that we end up paying down the road because we didn't tackle these problems head-on.
And here is just a perfect example of that cost in action. The data shows that about a fifth, that's 20%, of all healthcare spending is tied directly to income disparity.
I mean, that is a staggering amount of money, and it's a cost driven by the very gaps we've been talking about.
So here's the big takeaway. Investing in these areas isn't just a cost on a spreadsheet. The idea is that it generates all these compounding returns. You get long-term savings in incredibly expensive areas like healthcare. You see less demand on emergency services, a reduction in homelessness, and on the flip side, you get more people in the workforce, which boosts the whole economy. It's all connected.
So this all brings us to the big picture, the final takeaway. And the way the analysis frames it, it really comes down to a fundamental choice. We can either be proactive or we can be reactive.
And when you lay it all out on this social balance sheet we've been using, the whole story just snaps into focus, doesn't it? You've got the billions in investments on one side. In the middle, you have those deficits, the funding gap, the adequacy gap, and then on the other side, you see this really powerful argument for the massive long-term returns you could get if you deal with those deficits.
And so, ultimately, the analysis leaves us with this one really powerful question. It completely reframes the debate. Is all this social spending just a short-term cost that we should always be trying to cut? Or is it actually a long-term investment in the future health of our economy and our communities? It's a heck of a question to think about.